Namaskar. I am Dr. Kirti Srivastav, Head of the Department of University Environment at King George's Medical University, Lucknow. So in the month of March 2020, when COVID suddenly popped up, biomedical waste management was one of the major challenges besides other important tasks. The core members of University Environment Department took this challenge head on. We were instrumental in providing training to all team members before being posted in the COVID wards.
Hi, we're from Caesar Tropical Disease Hospital in Gauteng. All healthcare waste should be collected, processed, and disposed in a proper way, ensuring the safety of the staff members, patients, and the public. Therefore, Credit's grave principles should be practiced always. The COVID-19 pandemic has made it clear how much waste we generate in the health sector, and working to reduce it also means working on patient safety.
Namaskar.
La Fundación Clínica Infantil Club Noel, como institución de salud, tuvo que implementar mecanismos a nivel de infraestructura, procesos y adaptarse a los lineamientos de bioseguridad generados por el Ministerio de Salud para realizar un adecuado manejo de residuos COVID. Por lo tanto, nuestra verdadera labor se ha enfocado, además de mejorar los protocolos y disponer de los recursos, en concientizar, sensibilizar, generar adherencia, tanto en los pacientes, personal de enfermería, personal médico, personal administrativo y personal de servicios generales en la adecuada gestión desde la fuente. En Fundación Clínica Infantil Club Noel, las intervenciones que han marcado la diferencia para reforzar la gestión de los residuos fueron las siguientes. La sustitución de ropa desechable por prendas de tela como batas, overoles y escafandras, lo que permitió reemplazar el uso de elementos de protección personal desechables por recursos que disminuyeran la cantidad de residuos, brindando un 100% de efectividad en la bioprotección del personal de salud. El liderazgo del área de almacén y suministros con el programa de compras sostenibles, teniendo en cuenta el costo-beneficio y costo-calidad de los insumos que han sido comprados desde el inicio de la pandemia y que continúa funcionando en la actualidad. El apoyo por parte del Grupo Interdisciplinario COVID en la revisión de los algoritmos o infografía de elementos de protección personal para definir su uso con el personal, lo que ha generado un mejor control en el manejo del desperdicio. El tratamiento externo de los residuos bioinfecciosos COVID se ha manejado mediante tecnologías limpias de microondas e inactivación de la carga contaminante del residuo.
Good morning, good evening, good afternoon, wherever you are in the world. Thank you for attending this webinar. Today marks the document launch of the global analysis of healthcare waste in the context of COVID-19. I do encourage you to download it. I think there is a link to it in the chat. So this report is really timely. It has a spotlight on waste. in part from COVID-19 response, but in all the items used to that we procure, we use and discard in the giving of life-saving interventions. This is an opportunity to change systems and behaviours across the entire cradle to grave of healthcare waste. So the writing of today's report has been a truly collaborative effort. We will need even more collaboration and cooperation in future to implement those recommendations. We'd like to thank ISWA, the International Solid Waste Association, Healthcare Without Harm, United Nations Development Programme, the Global Fund, and the 11 countries who have featured in the case studies. A question and answer will be developed after the webinar based on the questions. There will also be discussion, so please do post any comments you have in the chat. The PowerPoint and Q&A will be available after on the WASH and Healthcare, the HCF website, and I encourage you to use the links. Apologies that there is no direct translation today. However, Miguel Lozano from ISWA will help with any Spanish and French translations of questions that are needed if you post them in the chat. The format of the webinar is as follows. After the opening comments from Dr. Maria Neira, the Director of Environment, Climate and Health from the World Health Organization, Dr. Maggie Montgomery, the Technical Officer of WASH, World Health Organization, will talk about the findings and recommendations of the report. We will then have a short reflection from 6 of the partners, and we will end the session with the closing remarks from Bruce Gordon, the coordinator from Water, Sanitation, Hygiene and Health Unit. So without further ado, it gives me great pleasure to introduce Dr. Maria Neira.
Thank you, Anne. Thank you so much. It's such a great pleasure to be with you and to see that there are so many people joining us at the moment. As you rightly say, Anne, this is a critical report, and I'm very happy that not only we give a kind of diagnosis of the situation, but I think we can as well propose several solutions, pragmatic, and making sure that everybody is aware of this problem and we will handle it on a different way. 3 messages, and very, very quickly. First, thanks to all who have contributed to this important report. You mentioned it then, and I don't want to take time again on mentioning it one by one, but our most appreciated and all our gratitude from WHO for the enormous and wonderful contribution. Second, protecting the health of our healthcare workers, protecting the health of the patients, and protecting the environment are not different agendas. We can all do together. We can protect our patients, we can protect our healthcare workers, and not destroying the environment. That's why we are together today. Second message, as you well know, COP26 and in general, the climate change debate is now requesting us, we have even proposed as the healthcare globally community to reduce our own carbon footprint. And this is an opportunity. We have to make our healthcare system zero carbon, that will be the idea, more resilient to climate change, and part of that big frame can incorporate a better management of the waste we generate. You will hear plenty of solutions in this webinar, so I'm not taking any more time because there are fantastic presentations, and hopefully each of you after this presentation, you will do a similar webinar on your own community, passing the message and stimulating more action. Over to you, Anne, and thank you very much.
Dr. Maria, thank you. That's really inspiring. I'd now like to introduce Maggie Montgomery, who is going to talk to us a little bit on the data, innovative solutions, and the recommendations from the report. Thank you, Maria. Hi, Maggie.
Hi, good afternoon, good morning. Thank you all. I am going to give you the highlights. Now, hopefully I can get my slides to work. Okay, so I'm just going to briefly run through. Hopefully you've had a chance to download the report. If not, you can do so after today's session. We know healthcare waste was problematic before the pandemic, right? We know that 2 in 3 healthcare facilities in the least developed countries lack the means to safely segregate or treat their waste. So that's quite an enormous number. We also know, and we found in our own analysis, which was looking at the PPE sent through the UN COVID-19 supply portal, which was more of an illustrative example for all the PPE that's been sent, that facilities have incurred 3 to 4 times an increase in the volume of waste. And in facilities that don't segregate the waste, this increases by 10-fold. You know, this, in addition, we have healthcare workers who are overstressed with increased patient loads and their own restrictions. It's really led to a catastrophe of the waste situation. And I'm not going to go into details on the consequences, but we know there's many. There's needle stick injuries, which are responsible for millions of infections of hepatitis B and C, for example, spread of infectious pathogens, including those that are resistant to antimicrobials. And probably most importantly is the release of furans and dioxins, which are polluting our air and are especially affecting those vulnerable communities living near healthcare facilities that burn waste, as well as the health workers themselves. What are we talking about when we talk about COVID-19 healthcare waste? Well, there's a number of things. You can see them in the table here. It's everything from masks and gloves and gowns to all the materials that are used for testing and for vaccination. So what did we actually find? This first table looks at the volume of gloves and masks that were shipped to the WHO regions starting in March of 2020 all the way through the end of 2021. Just wanted to highlight one figure here is that we actually sent almost 6 times as many gloves as masks. And I will come to this point in a minute, but one of our big recommendations is not to use PPE that's not needed. And in most, at least COVID-19 interactions, including vaccinations, gloves aren't needed. Instead, we should be promoting and facilitating and encouraging good hand hygiene with soap and water and alcohol-based hand rubs. The only other point I wanted to highlight from this plot is that you can see a large majority of the products were sent to Africa, and this is because that region in particular had the least amount of access, especially initially during the pandemic, to PPE supplies. Another important finding I wanted to highlight from the analysis was that 1/3 of the PPE that was sent could not be safely bagged or stored because there wasn't enough biohazard bags. So in total, there was 87,000 tons of PPE shipped, but only capacity of biohazard bags of 61,000 tons. And this is more emblematic of the fact that safe waste management, safe waste treated, is not considered part and parcel when we're ordering supplies and delivering supplies. And this is what really needs to change. We cannot think of the waste as something separate or something someone else deals with. It very much is a health sector and a health safety responsibility. I touched on this before. We found that almost half of the volume of waste was non-essential supplies. So non-essential things like hair and shoe covers, which aren't needed for COVID-19, some gloves, which aren't needed. And really is an amazing opportunity here to make sure we get the essential supplies to people that need them. And very much we recognize there are still health workers that don't have those essential medical masks and gowns and other things, but that we're not sending things that are going to also end up as waste and add to the burden already that exists of waste in healthcare facilities. So what are the solutions? I think the really exciting thing is there's lots of solutions, and many of these were already in place before the pandemic, and now we have another opportunity and an even much more pressing opportunity to address these solutions. The first is obviously prevention. If we can reduce the volume of waste, that's going to save us a lot of time and money and headaches. I wanted just to highlight that the United Kingdom had a quite successful gloves off campaign that had started back in 2019. And this gives a really important example of how you engage health workers from the ground up. They found that their most important intervention in that campaign was basically having an information booth in the hospital canteen where health workers, where patients could come and learn about when you need gloves, when you don't need gloves, why hand hygiene is so important. There's a number of other solutions that exist, and these all are based on the concepts of the circular economy and really important for implementing those commitments that Maria talked about that happened at COP26. So recycling, another important opportunity. We see that masks now are being used to make road materials, building materials. So that's an important opportunity. We also know that good, safe, well-managed disposal is important. And that issue obviously extends beyond the health sector. And it's really important we think about these cross-sectoral collaborations. A few more of the solutions that are quite important that we are highlighting in this report, and in particular things that the health sector can do, is packaging. We need less packaging. We need to use more sustainable materials, more bio-based materials, less secondary packaging. This not only will help the environment, but it saves money. So there's a real economic incentive. Vaccines, there's work obviously going on now about how we can increase vaccine stability. We didn't actually calculate the volume of vaccine wastage in our calculations, but that's another thing to consider. But also how we can get rid of syringes altogether and deliver vaccines still safely. Safe reusable masks. There's been a lot of interesting innovation on this. I would say probably now, and others, what we'll hear from others that are more connected to the private sector innovation is that the availability for the public is probably better. And there are now a number of FFP2 and N95 reusable masks out there. For the medical sector, I think there's still some innovation that needs to happen on the implementation, but that's certainly consideration. And there's a number of other solutions as well. I think the last thing I just wanted to emphasize was the using reverse logistics, and we're going to hear about this more from Malawi, and non-burn treatment. We have to stop burning plastics, in particular plastics from medical waste. Country case studies. To me, this was one of the most interesting parts of the report, and we had lots of conversations with more countries that are even then were included in the report. So please go to the website where you can find all of the case studies. Just two I wanted to highlight here that we won't hear speaking later is Colombia implemented a whole range of sustainable purchasing and looking at the socio-economic impact of their consumables. And certainly I hope the UN and WHO in particular can start shifting towards this. And that was complemented by better training around PPE use and national guidelines. In Laos, again, they already had the national leadership in place around climate safe and sustainable wash and energy services before the pandemic, which allowed them to come together during the pandemic to raise over $2 million of national funding to do a number of improvements, including putting in autoclaves. So what are the recommendations? The first is that we have to strengthen our coordination, and not just amongst each other, but also amongst the different areas, from logistics to infection prevention control to vaccine and environmental actors. We need to do more around promoting and investing in more sustainable waste services. There's obviously a really important behavior change component, right? The idea that more PPE is better is not necessarily true from an infection perspective, and definitely not from the environment perspective. And lastly, there's a real strong need to invest and promote more high quality regional and national PPE manufacturers. This will save a lot in terms of climate emissions from shipping goods over long distance, but it also means that we can make sure that the right things are arriving at the right time. Nationally, again, these are recommendations that we've drawn from a number of existing documents, but I think it's really important to bring them all together, is the importance of standards and regulations and the investment around healthcare waste from budgets and financing. The importance of monitoring. We've gotten lots of questions from the media about lots of specifics that we can't answer because we don't have those monitoring systems in place. And those are actually really important as well for accountability and knowing where we need to focus our efforts. So I just want to end to say that, and re-emphasize what Maria said at the beginning, is that we can protect our health workers, we can protect the public, but we also can protect the environment, and we cannot afford to no longer ignore the environment aspect. So there's lots of places where you can go to learn, from the WHO, UNICEF Global Wash and HCF Knowledge Portal, Healthcare Without Harm, UNDP, Green Waste. There's lots of sharing that needs to happen. And it's not just around this report, but it's around all the activities that are happening on the ground. And I encourage all of you, and certainly on our list at WHO, we have a list of items that we need to follow up on, but action, right? How do we review and include more sustainable PPE in our guidelines? How do we consider and factor in the social and environmental costs of everything that we're procuring? And what kind of technical and leadership support do we need to be providing to ministries of health around this issue of safe and sustainable waste management? So I'll end there. I'll hand it back to you, Anne, and thank you all.
Thank you, Maggie, and really insightful. We're going to learn a little bit more about some of the case studies now. So I will introduce each of these speakers. They will introduce themselves and then I will ask them a question. So without further ado, I'd like to start with Hilary Copatiza, please, who is the Quality Assurance Manager from R4H.
Thank you, Annie. From Malawi. Malawi is located in southern part of Africa. That's the SADC region. And we have been doing a part of our work on waste management. Next slide, please.
So just to say, reverse logistics is a really important solution for facilitating centralized and sustainable waste treatment. But Hilary, it's really hard to implement. So how did you establish this reverse logistics and what were your biggest challenges? And also, how can the lessons you've learned in Malawi be applied to other low-income countries? Thank you.
Right, thank you. So what we have done here is that we have been implementing a sample transport program within the country, and our network is spread in all regions, in all districts of the country. And we have been in Malawi, we have been here for at least 11 years, mainly transporting clinical samples and results. So using the same network which we already built, we have used the same by providing trainings on biosafety and waste management to our staff, the couriers, now to do the reverse transport, the reverse logistics. For the period of 2 years which we have been working on the system, we have so far handled 5.3 tons of waste. This waste is coming from different laboratories for COVID-19 tests and also HIV program. From the time we started to after coming of the COVID-19, we have seen almost double of the work which we have been handling for the past 2 years. So far with this work, the laboratories are able now to comply to the different quality standards like the ISO 15189 and also the good clinical laboratory practice. We did this work not on our own, but we also had to involve the local regulatory authorities like the Department of Environmental Health, which had to authorize us to be able to transport this particular waste. And as you rightly said, we have a centralized type of system where we are taking all this waste, specifically GTC, waste which is contaminated with guanidinium thiocyanate, and for safe disposal at proper incinerators. Thank you.
Thank you very much. Here you go, lessons learned.
Come again.
Sorry, thank you very much. Could we move to the next slide, please? So I'd now like to introduce Ramon San Pascal. He's the Executive Director for Healthcare Without Harm. Healthcare Without Harm has been working at country level for many years on improving the sustainability of healthcare waste management. Could you please share one of the successes in implementing an innovative solution? So for example, recycling, reverse logistics, and how easily can solutions that you've worked on be upscaled and what needs to happen in order to do that? So Ramon, if you could come on screen, please.
Thank you very much. I'm Ramon San Pascal with the Healthcare Without Harm in Southeast Asia. For the question, ever since the pandemic hit the globe in Southeast Asia early in 2020, some of the green hospitals that have been doing sustainability work already saw and experienced the initial phase when there was a shortage on PPE. So there are two things there, the shortage and the overproduction of plastic single-use PPE. And they try to address it by themselves. I'm talking about a hospital in the Philippines and other hospital in Indonesia, inventing and manufacturing their own reusable and washable PPE, so as not to be dependent and therefore not suffer from the shortage of protective gears for their staff. Also be able to reduce the waste, as they've been aware ever since of the need to reduce particularly plastic waste in hospitals. And as well to be able to save money. They realized, and what they did, particularly in St. Paul Hospital in Iloilo, in central Philippines, they began seeing the economics of it by computing how much are they able to save in terms of the cost in the PPE and how much they are able to put onto operations again, especially for other needs in the COVID response. And by doing it early as May in 2020, they're able to learn much further down the line up to the current situation when there's already a fourth wave of the COVID in our country. And the sharing continues. Case studies were developed from Indonesia to Philippines and then all over the Global Green and Healthy Hospital Network, up to the point that we're able to put online a set of tools and advice and policy statements on how to address reduction of PPE, therefore addressing plastic waste, therefore addressing the economics, the too much cost, as well as saving the environment. Thank you.
Thank you. Next slide, please. Thank you.
This slide talks about the continuity of our work on healthcare waste, particularly plastics, where 65% of a typical hospital output per day would be of plastics. This we found out as early as 2018, 2019. So when the pandemic hit, we also begin looking into the waste volume and outputs of the hospital, and another guideline came out recently, the plastic issues during a global pandemic. So we're able to do audit both in the pre and the post pandemic and be able to compare. And we saw now that due to the so much caution on the issue of safety and protecting the need to protect from further infection, but there is also so much waste, particularly whether it's the face shield, the face mask, and of course the gloves and the outfit, the robe themselves made of single-use plastic. And this has to be addressed, and we're continuing the intervention and the assistance and the partnership with the hospitals in Southeast Asia as well as all over the world. Thank you.
Thank you very, very much. Next slide, please. So I'd now like to introduce Simon Demir, the Operations Officer for the International Finance Corporation of the World Bank Group. So the ICF has published major international report on PPE and the circular economy in late 2021. It looked at key aspects of a circular economy and reviewed over 40 manufacturers who are producing more sustainable, safe PPE. In reflecting on the new WHO report, how did the ICF findings complement the WHO recommendations? And are there manufacturers with market-ready solutions that are safe in healthcare settings? And what is the role of the private sector in addressing this important issue as well? Thank you.
Thank you, Anne. First of all, I would like to congratulate WHO team on this fantastic report, giving invaluable insights that will encourage further innovations to move toward circularity. As you said, these both reports they published recently, and both of them emphasize on the waste problem and offer complementary solutions. WHO reports gives deep understanding and solutions for all type of COVID-19 essential and non-essential healthcare waste, including PPE testing and vaccination items, while our report was giving an emphasis on medical and non-medical grade PPE waste, mostly non-medical, and looking into circularity approaches already adopted by manufacturers that can offer scalable solutions. Our starting point was the fact of an estimated 3.4 billion single-use face masks and face shields are being discarded every day, and most of them are made of plastics. And another thing, these two reports also emphasize on the missing end step in waste management related to closing resource loops, as Mr. Hilary was emphasizing. And one recommendation WHO report made was leveraging reverse logistics and a centralized treatment of waste by using non-burn technologies. I find this very encouraging for private sector to follow. And designing the product to be circular is only one part of the story. And the other aspect is ensuring the resource loops can be closed at the end of useful life. And this requires digitization, capturing data during the life cycle of the product, and meaningfully using that information at the end of the service life. And for instance, from that regard, one of the market-ready solution we identified while looking into several companies was RFID or watermark technologies that enables traceability of product and communicate after use solution. Among all circularity patterns we have featured in our publication, the companies, especially the ones that offering their services as product via rental or leasing system, have a huge potential to execute circular economy principles by starting at design phase, which can be combined with these traceability technologies for an on-spot end-of-life solution. And in a nutshell, innovation is happening in a whole spectrum of PPE manufacturing. However, as you know, all knows, medical products, including PPEs, they are heavily regulated in most of the markets with strict standards, requirements, and national regulations. And these standards are based on generally polypropylene or plastic derived PPEs. And this is limiting the opportunity for new design or new fit to get certified or market the innovations as medical grade. And the role of private sector is clear, back to your question. And the role of private sector is substituting plastics with alternative materials like bio-based materials by ensuring they are met by standards, or adding new features to PPEs either to move from disposable to reusable or from non-medical to medical grade. However, this is challenging in current settings. Despite the challenges, there is a great need for continued investment in research and development for new materials. And to make it happen, there is an urgent need for all stakeholders to come together and create an enabling ecosystem, including standard bodies, testing facilities, governments, and all consumers.
Thank you very, very much. Our next speaker is Rosemary Kumwenda. She is the Regional HIV Health Team Lead for the UNDP, and she's from the Istanbul Regional Hub. UNDP is a very important partner in addressing safe and sustainable healthcare waste, especially considering the coordination and leadership role that the UNDP plays for the United Nations at country level. Rosemary, could you please tell us a bit about the challenges UNDP has seen during COVID-19, particularly regarding healthcare waste management? And how is UNDP addressing these challenges? And how will it contribute to the recommendations in the new report? Thank you.
Thank you very much, Moderator Anne. And let me take this opportunity to thank WHO for launching this timely report. And you will excuse me, I'll just turn off my camera because my Wi-Fi is quite slow. Again, thank you for this opportunity as we reflect on the healthcare waste management report being launched today. And it's really, really timely. You rightly said that UNDP is an important partner in sustainable development. Yes, we consider our thought leadership role in governance and integration of SDGs in the development plans, especially at country level. This would be an extremely timely occasion to integrate healthcare waste management. Again, one fact that might not be known by those who have joined on this webinar today is that UNDP currently supports more than 80% of all the development of the nationally determined contributions and also the voluntary national reviews for SDG attainment reports. A huge opportunity in our view to operationalize the WHO report recommendations to feed into implementation of the recommendations. So can you go to the next slide, please? Just to continue answering the questions that were posed to me about the challenges and lessons and how UNDP would use the recommendations. During the peak of the COVID, UNDP, Engineers Without Borders, and our partners, Healthcare Without Harm, the Global Fund, we conducted a rapid assessment on COVID waste in a number of countries globally. And just like the findings from WHO report, I think key for us was the finding on illegal dumping of healthcare waste and also the inadequacy in budget allocation, apart from other challenges such as insufficient PPEs for waste collectors and also waste cross-contamination. But then the question that arises is then, having learned these challenges, how does UNDP support healthcare waste management efforts? I want to reiterate that to tackle healthcare waste, we need to look at the broader development agenda at country level. There are indications at country level that there are initiatives to put in place mechanisms for coordinating waste management, including through governance mechanisms at city level, at national level, at municipality level. And so these must be enhanced. So working not only as UN agencies, but with others, we need to help countries develop the legal, the regulatory and policy environments and put in place mechanisms to guide managing waste at country level. There are also good practices that have been shared here and putting those into practice, scaling up, not starting from zero because efforts are there and also good lessons are there. So how will UNDP use the WHO report? Of course, at global level, you might know that UNDP coordinates with Healthcare Without Harm, the One Planet initiative of United Nations Environment Program, but also the Sustainable Procurement in the Health Sector Initiative with 10 members there. We support national multi-sectoral waste coordination mechanisms, which would be very critical using this report, and also ensuring that the health sector itself reduces its carbon footprint and capture this in the nationally determined contributions and the voluntary national reviews. Thank you, Maggie, for sharing the website where you can see most of the examples that arise on healthcare waste management on the Green Health Waste website that UNDP and partners have developed. Let me end here and happy to take more questions. Thank you.
Thank you very much, Rosemary. Thank you. Next slide, please. So I'd now like to introduce Juliette Bryant. She's the Medical Laboratory Specialist and Technical Advice Partnerships Department at the Global Fund. Juliette, why do you think the waste issue has largely been ignored? What can be done to change this? You do note that while the Global Fund country request for funding for healthcare waste has increased slightly from $6 million to $61 million, it is still really a very small proportion of the overall funding envelope for COVID-19, which is like $3 billion. So what can be done to increase country understanding and demand for waste support? And how can we make this information available at a global level? Thank you, Juliette.
So thank you, Anne, for inviting me here to be part of this, this wonderful webinar, and for a chance to try to address a difficult question. So let me just step back and say that the Global Fund is the world's largest purchaser of health commodities, and this includes therapeutics, diagnostics, reagents, and equipment and commodities, and recently medical oxygen. And we're really proud of the role that the Global Fund has played in addressing HIV, TB, and malaria, and more recently COVID. But our expenditures on the commodities themselves far outstrips the expenditures on taking care of the waste that's generated from them. So we have a 3-year funding cycle, and we work through these cycles. In the first funding cycle I have on the slide here, 3.5 million was the funding cycle from 2017 to 2019, the amount spent on waste management allocations. That increased in the next funding cycle, and then it jumped during the COVID response to 61 million. But overall, this accounts for still just 0.3% of all funds dispersed. So we know it's really inadequate. And the main reasons, I think, for this is similar to what's been talked about in previous speakers, the lack of awareness of waste problems and volumes, the hazards associated with them, and the lack of trained personnel. These problems have remained, have been neglected. There's countries that need a lot of equipment for disposal, and they need larger allocations to handle the transport costs. And there's a great need for governance at the senior level to manage and coordinate the waste systems. And we want to encourage these sorts of investments, but it's important to understand that the Global Fund is a country-driven operating model, and we have very few levers that we can use in order to have more prescriptive instructions given to the countries when they're providing and preparing their funding requests. So in 2019, a series of internal webinars were started to try to increase awareness and attention internally about waste management issues. A national waste management capacity tool was developed. We also held trainings for our local fund agents, which are the people on the ground in the countries that are receiving grants, to evaluate how the investments are being spent, and feedback information. We developed several technical information notes to try to explain to countries the kinds of eligible funding that can be included in their funding requests. Next slide, please. No, back, please. So we are country-driven operating model, but we're also very committed to monitoring and evaluating the efficiencies of our investments. And so we have a whole series of performance metrics that are used. Currently, there are no key KPIs, key performance indicators, that include measurements of waste streams. And so one of the first things that we can do for our next funding cycle is try to introduce indicators. And I have written down on the slide here 2 proposed indicators. One that would be the proportion of unused health products that are sent for disposal. And this would be a measure then of overstocking. and wastage in that sense. And another is to measure the proportion of the used products that are being collected as part of a formal waste stream. There are other indicators that are now currently being debated as we are reevaluating our performance metrics for the next funding cycle. The other thing that we really badly need to do within the Global Fund is clarify institutionally as an organization where the responsibility lies for championing waste management issues. We have our specified disease advisors, and we have a whole department in which I sit, which is responsible for health systems, but we don't have we don't have a single resident expert on technical waste management issues within the entire organization, and that needs to change. If we were to be able to hire such a person, then I think some of these other things that we could push for is exploring innovative solutions with the private sector. Private sector engagement is a critically important piece that the Global Fund is trying to always work with, and we need to do this for manufacturers for dealing with potentially equipment when it is retired and non-usable take-back kind of schemes. Also investing in innovative solutions for improving the whole supply chain management problem so that we reduce wastage and we have less expiries. If we can quantify the amount of products that we need, then we can have less wastage on that end. One suggestion has been to try to introduce a sort of tax that would be embedded within our funding request so that certain allocations towards, we would have minimum standards for allocations towards waste management as a percentage of the total amount that's being spent on health products. This is quite controversial, and there's no promise that we can include this in the next funding regime, but we have internal advocates who are trying to work in that direction. And then really importantly, what we can do is try to strengthen our partnerships and are working with other agencies, such as represented on this panel here, so that we collectively as a community raise awareness and try to push from all different directions such that the countries, when they're preparing their funding requests, they really highlight and get support from the Global Fund for all these needs. Thank you, Anne.
Thank you, Juliet. And as I say, it's so wide ranging. We have one more speaker now. We have Yingling Lin. She's the Technical Office for WHO Emergencies for Operations and Medical Devices. So, considering your role as a material science expert and the current work in reviewing and ensuring PPE is safe and meets user needs, what are some of the challenges incorporating the aspects of greener materials and reusable PPE in healthcare facilities? What do you think needs to be done to make such PPE more available and accessible? And how does PPE link some of the basic IPC principles about infection and prevention, for example, with regular hand hygiene? So if you could just sort of expand on some of those points, please, that would be lovely. Thank you.
Okay. Thank you, Dr. Woolridge. It's an honor to speak. Just gonna unmute myself. Yes, so it's an exciting time. I think I'll just tackle your first question about pretty much reducing the use of PPE. I think there's been a lot of legacy information or perceptions about PPE from the Ebola outbreaks. And so there's almost an overshoot of the use of PPE. So WHO did publish a guidance on the rational use of PPE, and this is to reduce the amount of PPE used. And for example, hand hygiene not being required for vaccinations, that means we don't need to source exam gloves. And that's, as Maggie had pointed, there's a lot of exam gloves have been used much more than any other type of PPE, and we have been procuring quite a lot of it, but it's not always necessary. In terms of the materials science engineering aspect, biodegradable materials have been developed for a long time, but its application for PPE is relatively new. especially during the COVID outbreak. We saw many of the partner organizations here on this webinar have been sourcing a large volume, WHO as well in particular. And these volumes have been something unimaginable, really. So in preparation for doing it better, maybe on hopefully a smaller scale, the incorporation of these biodegradable materials we know are not perfect solutions. They're a way to shift from materials and PP that may lie in landfills for hundreds of years to maybe a few hundred days. There is the challenge of tackling issues like off-gassing. There's some very promising materials that still meet performance requirements for individual PP, like exam gloves. They have their own material performance requirements. Manufacturers have been listening. I've been going to trade fairs where I've seen products that are commercially available. There's always a cost premium to that, so that's a challenge as well. We need to really get that scoring weight of sustainability into our procurement processes, so that even though there's an added cost to using these materials, we also know that the timeline for that product life cycle is shorter. And so, you know, we also know that there are standards related to how they degrade in landfills and oceans. There are ASTM standards, European norm standards. As long as manufacturers meet those requirements, we have some indication that they will perform under ideal and non-ideal conditions. But in terms of the materials engineering, it's just a question of incorporating that for medical type PPE and even non-medical like N95s and FFP2s. There's also several initiatives looking at reusable masks and respirators. There's a BARDA Next Generation Mask Initiative where 40 finalists from private industry and public and academia that responded to this call. Out of the 40, 10 finalists emerged. And of those, there's still about half that are FFP2 N95 type masks. So that's like high filtration for small 75 nanometer sized particles. That's what we use for N95, but they're highly breathable, sometimes almost transparent. So the future of these nonwovens, high quality nonwovens that can be perhaps merged with safe decontamination processes like light activated methylene blue that disrupt or inactivate coronaviruses. That's been validated in literature. There are ways to extend the life of these so-called single-use items, making them reusable. So that really extends some of these PPE items to longer useful periods. And I think I can go on. I mean, the low-hanging fruit is eliminating or minimizing single-use packaging. Pre-COVID, I had not seen single packaged medical masks. It's kind of like a fashion now, but it's not necessary. Within the European standard for medical masks, there is a kind of cleanliness test. So you don't need to package them into single packages. Plus, if they're still polymeric based, they off-gas. So you want them to off-gas before you put them on. So we need to counter kind of like trends that may mean we pay more, but we don't necessarily need. Likewise for coveralls, they're way more complicated. They need to be cut with legs and arms. And they're also warmer, they're more uncomfortable. And that was also a legacy from the Ebola outbreaks, which were for wet patients, high fluid situations. So we need to be selective about the PPE we use, just as our speakers discussed, that we need to get just the essential PPE out there. And we need to see also how we can incorporate biodegradable materials into these kind of known familiar PPE items.
Thank you. It's really interesting because we've now covered everything from moving the waste in the first place to how we manage the products, how we fund the projects, and now looking at design. So fascinating. Could I ask all the panelists to come back on screen, please. One thing I plan to do now is I'm going to ask you in turn, what is the first thing you are going to do in order how to, in terms of implementing your recommendations? What are the first things you're going to do after we get off this webinar? And we've got about 4 minutes, so it needs to be quite quick, but what do you think? So let's start with Hilary. What's the first thing that R4H is going to do?
Thank you, Annie. So as for us, what we are going to do is to build more of like a safe, sustainable waste management program, which have to run on its own, not only depending on donation but on its own, it has to be able to run. And also the issue of climate change will also be more focusing on the non-bent technologies, because that's the future, instead of mainly focusing on the incinerators, which currently there's much evidence that we have to lean towards the non-bent technologies. Thank you.
Brilliant, thank you, and hopefully the report will help you do that. Ramon, what is the first thing that Healthcare Without Harm is going to do?
Thank you. For some reason, my camera is not allowed to be turned on.
Don't worry, we can hear you.
Yeah. In the report, we put emphasis, and this we have done in several presentations and meetings that we had with Waste Management Authority in our ministry, that there should be a stronger coordination among logistics, infection prevention and control, vaccine laboratory, and the local government units, including our Department of Environment. This has not happened, and it has not been happening even in the times of COVID, but the several incidents of medical waste coming up from COVID vaccination, for example, or laboratories being picked up by children playing on the ground, has taught us lessons enough for the coordination to happen. And the stakeholders are various, including local government unit, including the laboratory people, including the private waste haulers, the Ministry of Environment, and the Department of Health, of course. So that coordination is a pressing one that should happen even now.
Thank you. Thank you. Yeah, really important. Sinem, what's the first thing that the IFC is going to do?
Yeah, the first thing IFC going to do is to be part of this joint action. IFC is representing the private sector, and we from the report, WHO report, we can see that there are some solutions tried in France, Colombia, and so on. And also in our report, we have seen some solutions for PP manufacturers to move toward a circular economy. However, most of these solutions are not scaled yet. And as IFC, our role is helping the manufacturers in emerging markets and being part of the dialogue especially to bring a system approach.
Thank you, really, really helpful. Rosemary, what's the UNDP going to do? Thank you.
Thanks. Oh, I was failing to unmute myself. So, like I said earlier, UNDP is present in more than 170 countries. This in itself is a big strength, and one that we should use almost immediately. Using this report, disseminate it to this pool of players who can bring the report, bring the report alive in terms of implementing the recommendations. And linked to that, UNDP and Healthcare Without Harm and WHO, as I said earlier, are already working on initiatives for healthcare waste management. So we will use this opportunity, the programming opportunity, to make sure that countries look at their legislation, they look at the regulations and policies, and where they see gaps, to encourage them really to begin to use their national resources and partners, including private sector, to implement recommendations of the report and deploy it more aggressively and effectively at country level, to make sure that the tools that we have available can be put to good use, including, for example, the developed sustainable procurement index for health, which can be used jointly with this report to make sure that the health sector can measure the carbon footprint that arises from improper healthcare waste management at country level, and then begin to have health sector reporting through their voluntary national reviews.
Brilliant.
National determined.
Thank you. I'm afraid we've run out of time, because I do want to leave just a few minutes for the closing remarks from Bruce Gordon, who is the coordinator. So apologies, Union, and to Juliet, I didn't have time to come to you. But Bruce, if you could please close this seminar for us, this webinar, that would be lovely. Thank you very much. And thank you everybody for your attention.
Thank you so much, Anne, and thank everyone. It was really a tremendous kind of privilege to just listen to all the presenters, and thank you very much, but also just to see the really rich exchanges in the chat. And I must say, there was quite a range of discussion that I witnessed. And maybe what I'd like to do is just to kind of point to, I think, what are 4 areas that we need to collectively follow up on together. And as you may have all noticed, this has been a result of WHO working in partnership, and we hope to work with partners as we move into the future on this. I think one of the first things that struck me was that in order to raise awareness around the healthcare waste, I guess, crisis, we need to have better monitoring. So we were able to, kind of show the world a little bit how deficient healthcare waste management systems were, and also the waste left over because we had monitoring in place. There was a lot of comments around cost, the costs associated with healthcare waste, and there was also questions around, or possibilities around, talking about the cost savings. So I think generating some of that awareness is very critical. Generating that evidence is very critical to building the awareness and political will that's going to be required to make all this work. I think the second issue is all this whole big issue around good practice. There are many great technical questions around disposing hazardous laboratory liquid waste, how one does that. There's issues around, technologies, and whether that's incineration or non-burn technologies or PPE. It's very complex stuff. And so communities of practice to help, I think, are something that we as WHO with partners can help on, as well as guidelines and good practice, networks. So bringing your experiences together to help solve problems, which was also happening organically. Third area is innovation. And I think it was really, it's great to see that there was, again, from the chat, but also in our discussions, just really interesting product innovations from the private sector that are being offered. There's certainly more interest, both on recyclable or reusable, for example, PPE, but across the spectrum of healthcare waste. We also need innovation in systems in terms of how we deal with waste as sort of a circular economy. So I think that is something we'll need to push. The third area is something that I think we'll work on, and it was really interesting to listen to our colleague from the Global Fund and Ying from the WHO Emergency Program talk about their experiences with planning and procurement, and how we need to do a better job of putting together things like indicators to allow countries to better express some of the waste issues, or precisely express some of the waste management issues before procuring, as well as scoring weights for purchasing. So if things last longer, as Ying said, that should be taken into account, and also the costs, the community costs, and the cost to disposal, because as someone else said, I think this is not just a healthcare waste management issue. This is a waste management issue and we have probably unprecedented concern and attention right now from those that care about the environment, that care about climate change, and obviously health issues, including COVID. So maybe I will just conclude by saying, I think we will certainly, as WHO, we're tremendously committed to this. We're tremendously committed to providing technical assistance, especially with regulation and policy. But all those things I mentioned, we're committed to working through this wonderful partnership. So on behalf of WHO and in coordination with the team here led by Maria and Maggie, we will be in touch with you to answer any other questions, but really to try to galvanize and strengthen this work, and that this report was a wake-up call for all of us to continue to strengthen our attention in this matter. So with that, I would like to thank everyone. Thank you, Anne, for moderating, and have a great rest of your day.
Thank you very much. Thank you. Goodbye.
Thank you.
Bye. Thank you, everyone.
Bye, thank
You all.
you. Bye-bye.
Nice to see you.
Thank you. Bye-bye.
Thank you so much. Bye.
Bye.
Okay.